Hello, this is Professor Hale. I'll be covering in this video content from chapter 49. This focuses on the nursing care plan and the nursing process. So I will be listing multiple of nursing diagnoses and nursing interventions for clients with cerebral vascular disorders or who had stroke. So these are the nursing diagnoses for you to review. These are also in your chapter in your medical surgical book in chapter 49. This is on page, I think, 1065. So we got ineffective airway clearance, risk for injury, impaired physical mobility, imbalanced nutrition, risk for impaired integrity, incontinence, and then continuing on with the nursing diagnoses of self-care deficit, impaired verbal communication, acute or chronic confusion, risk for falls, deficient knowledge related to what, risk for caregiver role strain. Here's one right here. This is a risk for, this is imbalanced nutrition, nursing diagnoses. So why is this so important? It is related to less than body requirements related to impaired swallowing and motor deficits. Expected outcomes: the patient will remain adequate nutrition without aspiration, as evidenced by stable weight and appropriate level for height, and no signs or symptoms of aspiration. Your nursing interventions for this diagnosis to implement into your care is to keep the patient NPO until swallowing can be evaluated to prevent aspiration. You want to perform a dysphagia screening. This is a quick assessment that can identify problems before complete evaluation can be done. Observe for facial weaknesses or inability to completely close mouth. Ask the patient to stick out tongue and move it from side to side. Observe for drooling. And if patient appears to be intact, then have the patient swallow a sip of water from a cup before offering other foods or fluids. Observe for coughing, choking, or noisy lung sounds. These are signs of difficulty swallowing. And request a speech pathologist evaluation if indicated to diagnose specific swallowing problems and to make recommendations. Here is another nursing diagnosis, which is risk for ineffective cerebral perfusion. So this is related to interruption of blood supply of the brain. Expected outcome is the patient will experience improved cerebral tissue perfusion as evidenced by absence of reduction in dizziness, syncope, and visual disturbances, improve of level of consciousness, pupils are equal and reactive to light, and improved motor and sensory function. So those are the expected outcomes. Your nursing interventions is to monitor neurological status at least every 30 minutes initially, and then every 4 hours as ordered, and report any changes. Rationale for this intervention is a change in status could indicate a decrease in perfusion. You want to assess vital signs every 30 minutes initially, and then every 4 hours as ordered. Rationale for this intervention is high or low blood pressure can lead to a decreased tissue perfusion and recurrent stroke. So temperature above 99.6 can worsen ischemic injury to the brain tissue. Monitor oxygen saturation and administer O2 as ordered for peripheral oxygen saturation, which if it's less than 92%. Hypoxemia can increase brain damage, so that's the rationale for that. Monitor blood glucose as ordered and report value greater than 140. So the rationale for this is to elevate glucose is associated with worsening of the infarct and hemorrhage. Also, you want to keep the head of the bed 20 to 30 degrees. Keep the neck in a neutral position. Rationale for this is it facilitates a venous return and reduces risk of cerebral edema. And then you want to monitor medications for therapeutic and non-therapeutic effects. Monitor coagulation studies if appropriate. Rationale for this is anticoagulant therapy must be closely monitored to make sure it is at a therapeutic level and not increasing risk for bleeding. Another nursing diagnosis for you to keep in mind is the ineffective airway clearance, which is related to stasis of secretions associated with decreased mobility and poor cough effort and airway obstruction resulting from tongue falling back in the throat. Expected outcome is the patient will remain in open airway as evidenced by respirations quiet and unlabored. Normal respiration should be at least 12 to 20 per minute, and with an oxygen saturation greater than 92%. Your nursing interventions will monitor lung sounds, cough, and respirations. Rationale for this is assessment provides the basis for interventions. In an evaluation, are the lung sounds clear? Is cough effective? Are respirations quiet and easy? Another in nursing intervention, you want to position the patient to maintain an open airway. So the rationale is side lying may keep the tongue from obstructing the airway. And is the patient positioned to keep the airway clear? And another intervention is to consult with a registered nurse or healthcare provider about an oral airway if airway is not clear. So an oral airway will keep the tongue from obstructing airway if needed. And then evaluation is the airway indicated. Encourage patient to deep breathe and cough if able. Coughing and deep breathing will help clear secretions from airway and prevent atelectasis, which is evaluation is the patient able to keep deep breaths and cough. Is a cough effective? And cough is ineffective. Suction may be required. Suctioning may be needed if the patient is unable to swallow secretions or cough effectively. Nursing diagnoses of risk for injury related to seizure, repeat stroke, or hemorrhage secondary to thrombolytic therapy. Expected outcome with the patient will remain free from injury. Nursing interventions include monitor neurological status frequently and report changes promptly. Prompt recognition of repeat stroke is essential. Monitor signs for hemorrhage for 24 to 36 hours following thrombolytic therapy. Hemorrhage is most common side effect of the thrombolytic therapy. And administer anticonvulsant agents as ordered. Patient is at an increased risk for seizures following a stroke. And implement seizure precautions. Precautions help protect a patient in the event of a seizure. And assist with transfers and ambulation. Patient is at risk for falls because of the motor and sensory deficits and impaired judgment. So those are the things that you want to consider. Implement measures to prevent aspiration. Stay with the patient during meals. Ensure the patient is fully alert before feeding them. Want to place the patient in a high Fowler position for chair for meals. Avoid use of straws. Use thickening agent if swallowing study recommends. Place food in an unaffected side of the mouth so they're able to chew it. Teach the patient to swallow twice before each bite. Check the patient's mouth for pocketing of food, and have a suction equipment available. And then notify the healthcare provider if patient is unable to take adequate oral calories. A food feeding tube may be needed if the patient cannot take enough calories to maintain nutrition. So advanced directives should be consulted before a feeding tube is placed. And also you want to assist with insertion and care of the feeding tube if needed. And if the patient cannot swallow effectively, a feeding tube may be needed to maintain nutrition. And then we have impaired physical mobility. It's related to decrease in motor function. Expected outcome for this diagnosis, the patient will maintain physical mobility as evidenced by maximum physical ability with limitations of deficits. The patient will not experience complications related to immobility. So that is the expected outcome for this diagnosis. Your nursing interventions will, you want to consult physical and occupational therapists to assess the patient's abilities to make specific recommendations related to mobility. Discuss the use of constraint therapy with physical and occupational therapists. Constraint therapy forces the use of affected limbs by restraining the unaffected side. Maintain the patient in correct body alignment to prevent contractures and promote comfort. Support affected extremities with pillow to prevent dislocation injuries and promote comfort. perform range of motion exercises as prescribed by the physical therapist to prevent any contractures or atrophy, and follow physical occupational therapy recommendations for being up in chair or ambulation. Prolonged bed rest is associated with complications and poor outcomes. If the patient is unable to get out of bed, you want to turn and reposition at least every 2 hours to prevent skin, respiratory, and musculoskeletal complications. Disturbed sensory perception related to a central nervous system damage. Expected outcome for this diagnosis is the patient will adapt to sensory perceptual deficits as evidenced by avoidance of injury to the affected areas. Your nursing interventions will include assist the occupational therapist to assess for visual or spatial deficits and decrease sensory perception like heat and cold, position of body parts, and pressure. Identification of a specific deficits in the first step in creating a plan of care. You want to teach the patient to scan the environment to compensate for visual deficit. Implement plans for skin integrity and mobility to protect the patient from complications related to sensory deficits. Risk for impaired skin integrity, irritation, or breakdown related to immobility or incontinence. Expected outcome, the patient's skin integrity will be maintained as evidenced by absence of redness or breakdown. Your nursing interventions will include examining of the skin often for redness or breakdown, especially around the bony prominences, depending on the areas and dependent areas and perineum. Any signs of breakdown must be treated immediately to prevent further damage. Thoroughly cleanse and dry the perineal area after each episode of incontinence. Urine and feces can be very irritating to the skin, so it can cause further breakdown. If incontinence is unavoidable, use a barrier cream such as zinc oxide to protect the skin. Turn and reposition the patient every 2 hours or more. Often, if the patient experiences breakdowns, pressure impairs circulation and increases risk of breakdown. Use of lift sheet to move the patient in the bed to avoid damage from friction and shear. So we already been through this in the beginning of the semester. Consider the use of a pressure-reducing mattress if patient cannot be out of bed for prolonged periods. This helps reduce pressure but does not eliminate the need for repositioning of the patient every 2 hours. If breakdown occurs, contact a healthcare provider or wound care specialist to obtain treatment and recommendations. And the nursing diagnosis, incontinence related to loss of voluntary control of elimination. Expected outcome, episodes of incontinence are avoided, or if unavoidable, they will be cleaned up quickly and skin complications avoided. Your nursing interventions include monitoring for incontinence or bowel or bladder so the patient can be cleaned promptly and skin protected. Determine usual pattern of urinary and bowel elimination. Keeping the patient on his or her regular pre-hospitalization pattern may help prevent incontinence. Provide assistance with toileting according to the patient's usual schedule. The patient who is unable to get up unaided may wait too long for the help and try to get up alone and be injured. So they may end up falling. So respond quickly to the request for assistance with toileting and avoid accidental incontinence. Self-care deficits, which include bathing, dressing, feeding, or toileting, is related to impaired motor function, spatial perceptual alterations, and fear of injury. Expected outcome is self-care will be accomplished as evidenced by the patient's ADLs needs to being met and patient becoming increasingly independent. Your nursing interventions include to determine the patient's ability to perform ADLs. A good baseline data will guide development of the care plan and work with the patient to create a plan for meeting daily physical needs. The patient will be more likely to participate in the plan if she or he are participate in creating it. Encourage the highest level of independence as possible and facilitate the patient's ability to do ADLs. And this is by providing too much assistance can promote dependence and further loss of mobility. Place objects within reach and within visual fields. Place fluids within the patient's visual field. And encourage use of assistive devices. Assist a patient with learning to use a non-dominant side of the body. So rationale is if the dominant side is affected, the patient may have to use the non-dominant side. Provide positive feedback, and this is to help reduce discouragement with slow progress. And provide education for family members and significant others regarding the patient's deficits and recovery plan. The family can assist the patient with mobility if they can understand what needs to be done. Impaired verbal communication is dysarthria, another term for that. It's related to loss of motor function of the muscles of speech, articulation, or aphasia, or dysphagia related to ischemia of the dominant hemisphere, which is left. Expected outcome is communication needs will be met as evidenced by the patient communicating needs and desires effectively and avoidance of frustration. So your nursing interventions will include listen for difficulties in verbal communication, speak in difficulty articulating or incorrect ordering of words, inability to find names of words or objects. A good baseline data will guide the planning of care. Consult a speech pathologist for assistance in determining types of aphasia or dysphagia and the need for follow-up and treatment. A speech pathologist is specially trained to diagnose and treat communication problems and can work with nursing staff to develop a plan of care. Implement measures to facilitate communications. These measures help ensure the patient has his or her immediate needs met while learning to adapt to the communication impairment. Answer call light in person rather than over the intercom. Assess the patient's needs frequently. Listen carefully and avoid interrupting the patient. Allow ample time for them to express their needs and for communication. When the patient is tired, ask questions that require short answers. Provide appropriate aids to communication, such as like picture boards, magic slate, or pencil and paper. Provide education to family members and significant others regarding communication problems and interventions, and this is so they can communicate with the patient and participate in the care. If the patient is unable to communicate, do not assume that she or he cannot hear or understand. Make every effort to speak to the patient and to keep conversation appropriate when it is within the patient's range of hearing. And this is because the patient may understand exactly what is being said, and if he or she is unable to respond. Contact the healthcare provider if impairment increases, and this may be a sign of a stroke extension. And this is an example of a picture board that you can use for communication. The patient can point out of what they want. If they can't verbally speak or articulate words, they can point out to the pictures and identify and point to the things that they not need. So if they need to go to the bathroom, they can point to the toilet, or if they need a urinal, to the urinal. And here's another nursing diagnosis, acute or chronic confusion. And this is related to cerebral ischemia. An expected outcome is the patient's thought process will be clear as possible within the limitations of brain damage, as evidenced by response appropriate to the situation. So the patient's safety will be maintained and the patient will feel calm and safe. Your nursing intervention for this diagnosis is to observe for thought process impairment, such as shortened attention span, impaired memory, confusion, slowed or quick and impulsive responses, or aggressive and inappropriate responses. Rationale is disturbing thinking can be manifested in a variety of ways. So you can also see the interventions. It kind of applies to the interventions for patients with disturbed thought processes. And here's another one, risk for falls, and this is related to change in mobility, sensation, or confusion. Expected outcome for this nursing diagnosis is the patient will remain safe and free from falls. Your your interventions would include perform a fall risk assessment according to the agency policy, and this is to identify patients at risk. Instruct the patient and family to call for help before the patient gets up so the staff can assist. Keep the call light and other essential items within the patient's reach to prevent falls while trying to access the needed items. Provide frequent toileting. So patients often fall while getting up to use the toilet. Avoid restraints if at all possible. Restraints are associated with injuries. And last would be deficient in knowledge, and this is related to diagnosis and treatment. Expected outcome, the patient and family will have necessary knowledge to make decisions and assist with care. So nursing interventions include, you want to explain what has happened to the patient. You want to explain test procedures and care activities. Reason is the patient and family members are likely to be frightened about what is happening. So providing correct information about what a stroke is, test and procedures and rationale for care activities, it does help reduce anxiety. Present information in small amounts as simply as possible. The patient may have difficulty managing large amounts of information while being acutely ill or confusion is present. Orient the patient and family to the ICU or other setting and the constant monitoring provided. This can help reduce anxiety and reassure the patient and family that the patient is receiving competent care. If the patient is to be discharged to home, make sure information is provided related to medication, treatments, and follow-up care. The patient and family need to know how to provide appropriate care at home, and evaluate the need for home health care nursing, like physical therapy or occupational therapy, and request appropriate referrals. The patient will likely need to have continued therapy after discharge to regain as much function as possible. So the takeaway from this video, and after all the nursing diagnoses that we reviewed, that are reviewed with you, the priority nursing diagnoses for you to really focus on are the risk for ineffective cerebral tissue perfusion, ineffective airway clearance, and risk for injury.